Just wanted to talk to everybody a little bit about exercise during pregnancy. It is a very common question that we get during a lot of our newer visits when patients come and say, oh, well, my grandma told me that I can't reach above my head because my placenta is going to come off or it's going to hurt the baby or something. Well, sorry to spoil the news, ladies, but you can reach, you can bend and pick things up, and nothing bad will happen to you or your baby. So right now, the American Heart Association recommends that everybody, pregnant or not, has at least 150 minutes of moderate intensity exercise per week. So if you break that down, that's about 30 minutes of moderate exercise 5 times a week. For those of us who are guilty of not exercising as we should, you can start out a little easier. So instead of doing 30-minute sessions, you can break that down into 10 or 15-minute sessions until you start to build up your stamina, so you can go the whole 30 minutes and without having any shortness of breath or chest pains or anything like that. So before you become pregnant, it's a really great thing for exercise to be a part of your routine. And partially that is because if you exercise and you have a good healthy eating habits, then your risk of developing gestational diabetes during pregnancy has been cut in half. And that's pretty significant because there are a lot of risks that go along with gestational diabetes, which will be a future video. So cutting your risk in half is a very significant thing for something that we should all be doing every day anyway. And also, whenever we're trying to become pregnant or during pregnancy, our motivation to be healthy has significantly increased because not only are we exercising, eating for ourselves, but we're also exercising and eating for our babies. Now, during pregnancy, like I said before, you really don't have that many limitations on what types of exercise you're able to take part in. So, of course, cardio exercise is fine, as well as weight-bearing exercise. So basically, you can do any types of exercises you did before you got pregnant, and just modify the type and intensity of exercise based on your gestational age or how big your baby has been growing. So the American College of Obstetrics and Gynecology have a specific list of exercises that they have deemed unsafe for pregnant women, and those include contact sports that would put you at a higher risk for having a fall or a hit to your stomach, skydiving and scuba diving, and hot yoga and hot Pilates and skydiving. So not very many people I know engage in those activities while they're pregnant, but they thought that they would list those for you just in case you were. So while you are exercising, some warning signs to look out for that you might be having too intensive a workout would be if you're experiencing bleeding, cramping, regular contractions, leaking of amniotic fluid, dizziness, chest pain, and shortness of breath. So if you're experiencing any of those, please slow down and take a break. Also, while you're exercising, you want to make sure that you're wearing loose-fitting clothing and are staying very well hydrated, because when you're pregnant, you need a little bit more water than when you're not pregnant, so you can lose that water just as easily when you're exercising, so be very careful about that. Finally, I know a lot of people tend to be a little concerned about whether or not their activities are going to put them into preterm labor or to have an early baby, and studies have shown that this is not the case. And also, you exercising and gaining a healthy amount of weight during pregnancy doesn't decrease the amount of weight that your baby would gain significantly. So by exercising, you are just creating a better home for your baby. Finally, during the postpartum period, and when I say postpartum period, I mean once you come to see us for your 6-week visit and we say that everything looks good and fine and you can return to all of your normal activity, whenever you exercise in that postpartum period, you are decreasing your likelihood of gaining too much weight in that period, and also retaining the weight that you gained while you were pregnant. And that's a really great thing, because if you're planning on having babies in the future, you're just kind of compounding the weight that you've been gaining instead of going back to your pre-pregnancy weight. And it's really good to keep that in mind, because whenever you continue to gain that much weight and you haven't been losing it and going back to your pre-pregnancy weight, you're more likely to develop gestational diabetes and pregnancy-induced hypertension, which can lead to some other issues. So we want to keep all of our mamas and babies nice and healthy so they can have their babies here with us at the birth center. So if you guys have any other questions or concerns about specific activities or exercises that you can engage in while you're pregnant, we'd be happy to answer those questions. So just call us and schedule an appointment, and we are happy to see you soon.